Thursday, Therapeutic Thursday. Let's see what was on the books for last week. Who's heard about the term scanxiety? I know we talked about this before. I suffer from scanxiety, nowhere near as bad as I did, years ago, because it's been almost 10 years for me, but I definitely suffer from it. And absolutely, when it's a new test, there should be new testiety. Come to coin that phrase. So, scanxiety is actually a term that describes anxiety or distress that people might feel before, during, or after a scan or any kind of imaging test. It can also refer to the apprehension that people feel with a chronic condition such as aortic disease. It's just what you feel that makes you not feel great when you're waiting for that next scan, but you know it's been scheduled and it's coming up. Scanxiety can be especially common for people with conditions that require regular exams, and this can be aortic disease patients who often have tests at regular intervals. And some of the sources of scanxiety include waiting for the scan date, waiting to be called in, hearing your name, Karen, come back. That creates a lot of anxiety for people. Waiting for the results definitely creates that anxiety. Anxiety is about the scan itself. It's the word scan. It's getting in my mouth. Anxiety is about the scan itself and worries about what the results might mean. For me, honestly, it's feeling the dye coursing through my veins. So it's if they definitely want a CAT scan, I'm anxious because I have to be pre-medicated and I don't want to have an anaphylactic reaction. And I hate the way that contrast feels. It just makes your head feel like it's going to explode, makes you feel warm. Not everyone, just me. It makes you feel like you have to pee. It's just not pleasant. Gadolinium, which is what you get with an MRI, I don't really feel much. Sometimes it's burned, and I have a lot of anxiety if it's going to hurt. I don't care about being in the machine. I fall asleep, and I don't worry so much about the results, especially if I've had an echo beforehand, because I know already that things haven't really changed from that literal perspective. I'm more concerned for me about what I'm going to feel like if it's going to hurt. That's just my own issues. But some of the things you can do to really reduce these feelings of anxiety starts with what I just did, acknowledging your feelings. Once you realize the source of your anxiety, it gets a little bit easier. And if you want to talk to more people about it, then you should join a support group. And because I'm a shameless plugging kind of person, we offer at least 7 different support groups, 8, I think we're up to. We have 3 different general support groups, all at Eastern time zones, are on the first Tuesday of the month at 12, the second Tuesday at 10 p.m., and the last Wednesday at 7 p.m. Every other month, we offer a grief support group. We also offer 2 caregiver support groups. The first is it the first Monday? No, that's not it. But they're on our website. I can't remember right now. But we have one at 10 p.m. and we have one at 8 p.m. We also have a support group that just launched this month in Spanish. And we've also partnered with our patient group in Canada, and we offer one for the Canadians as well at 7 p.m. So you can join a support group meeting and really feel validated when you talk to other people and hear that they have anxiety around scans and tests as well. Try distracting yourself. Like, it's going to happen. You have to have it. And the answer's already been decided. Your body already it's not going to suddenly grow when you're in the machine. It's already there. If you have growth, it's already happened. So just distract yourself if you can. Ask them if they play music. Decide what radio station you want to listen to. For me personally, I do count. If I'm not asleep, I'm counting. I'm counting the I count the sounds. 1, 2, 3, 4. I try to see patterns in the sounds. It sounds weird, but the next thing you know, it's over. I'm so incredibly distracted that I forget to hold my breath. So yeah, distraction really does work. Meditate. This is a great time to practice meditation when you're in a CTs happen too quickly, but if you're in an MRI, or if you want to do it when you're getting a CT, do it then too. From the moment you go in, they put the IV in, just start meditating. Just do a body scan on yourself while you're being scanned. Practice your breathing. Learn how to react to scanxiety. What is the best way for you to try to react when you feel the anxiety coming? Like, how can you best ground yourself? And setting a time limit on conscious worries. We all are going to worry, but if you say to yourself, I'm going to allow myself from the moment I'm driving there and filling out paperwork and get the IV, and then I'm done. I'm just going to focus on the 7 minutes it takes, and then I'm out of there and I'm finished. You have to figure out what's going to work for you. But if you think you're experiencing scanxiety, you want to talk to your physician or your therapist for additional tools that might help you erase the fears. There's no reason to be uncomfortable emotionally during a scan or a test. Like, let other people help you, whether it's your community through a support group or your clinicians or your therapist. Let them help you figure out ways to relieve some of your anxieties and fears. And that's your Wednesday. That's your Thursday. Oh, that's your Thursday.
Therapeutic Thursday at that.